Okay, let's begin chapter 13. We are not alone. We know that our body is constantly in a state of dynamic equilibrium. In other words, we are constantly coming in contact with organisms outside of our body that causes our body to have to react to them. Now, we know that many interactions between the human body and microorganisms involves those biofilms that were discussed in previous chapters. And remember that colonization is just a natural process that occurs basically from birth until death. Most significant interactions that we have with microbes provide a protective, stabilized effect. Sometimes microbes are involved in the maturation of a host's defense and development of our immune system, but unfortunately, oftentimes they can invade and grow in sterile tissue and cause disease. So what is contact, colonization, infection, and disease? Well, remember that microbes that are engaged in mutual or commensal symbiotic relationships are considered to be normal resident microbiota. Other terms for normal resident microbiota would be indigenous or microflora or normal flora. Okay, three definitions definitely that you need to know are: what is an infection? This is any condition in which pathogenic microbes penetrate the host defense, enter the tissues, and begin to multiply. Well, what is a pathogen? A pathogen is a microbe acting as an infectious agent, and as a result of pathogens and infection, that leads to infectious disease. And the key word there is that not only have they entered and begun to multiply, but they cause damage and disruption to tissues and organs. So if we look at this chart, we see that contact, right, is where microbes are going to adhere to our external body surfaces. Once that occurs, we often get colonization, which can lead to invasion. Now, not all colonization leads to invasion, but those that do can then do what? Cause infection, and depending on a carrier state, in other words, depending on the state, if, for example, if the person or patient is immunocompromised or compromised in any way, then that can cause issues. But when we get infection, then our defenses are going to keep them in check, or if they do not keep them in check, then it's going to lead to potential morbidity or mortality. Okay, so humans. All right, we have internal organs, tissues, and fluids. These should be microbe-free. So when our body comes in contact with the outside environment, we talk about either the resident microbes or the transient microbes that we come in contact. And so residents would be microbes that become established. Transients would be transients would occupy only for a short period of time and then be gone. Okay, so where are some places on our body that harbor natural, normal, resident microbes? Well, clearly the skin, right? If the skin is coming in contact with the external world, then we would expect there to be microbes present. Well, remember that when we're talking about the skin, we often then lead to mucous membranes as well. We would expect our upper respiratory tract to have resident microbes, because let's face it, we have to eat, therefore we are exposing the external world to our internal human body, so we would expect that. That would be things like the oral cavity, pharynx, nasal mucosa. Going down, I'm sorry, I said eat. That clearly is the gastrointestinal tract. I apologize. Breathe. We must breathe, and then that would be the respiratory tract. And we would expect them to be found on the external part of our urethra. We would expect it to be on our external genitalia, vagina, obviously if you're female, external ear and canal, and external eye. Now, generally, the microbiota will fluctuate depending on our age, our diet, our hygiene, our hormones, drug therapy, and overall general health. We also need to realize that microbiota will often benefit the host by keeping harmful microbes from getting out of control. And we call this microbial antagonism. So believe it or not, our resident microbiota kind of are known by our bodies, and therefore if some outside or transient microbe comes in and starts to get out of control in numbers, our normal resident biota will often antagonistically keep them in line or attempt to keep them in line. All right, endogenous infections occur when normal flora is introduced to a site that was previously sterile. So, where are some anatomical sites that are sterile or axenic? Okay, axenic is the term for microbe-free. Well, clearly we would hope that heart and circulatory system would be axenic. We would hope that our liver, our kidneys, our bladder, our lungs, oh my goodness, brain and spinal cord, absolutely axenic, muscles axenic, bones, gonads, ovaries, testes, glands, salivary, pancreas, sinuses, middle and inner ear, and internal eye. We would expect these places to be free from microbes. Well, if those are the organs that are associated with an axenic condition, we would also expect for blood, urine, CSF, cerebral spinal fluid, saliva prior to entering the oral cavity, and semen to also be axenic. Now, please understand that microbiota, normal flora, is essential to the good health or overall health of humans. And we know that by having these natural flora, that our defense system is enhanced. Please understand that when we take antibiotics, or if we change our diet, or if we get some disease, that this can absolutely affect our normal flora. And so the big trend, especially right now, is to take probiotics, which is basically trying to put those, quote, good bacteria back into our system so that our systems can function properly. So, concept checked. Normal resident microbes are absent from what? Where would we expect normal resident microbes to be absent? And hopefully you said lungs. Okay? So lungs would be one of the places that we would hope would be axenic. Now you and I know that often that's not the case, and thus that's when we get sick. Alright, so what are some factors for developing infection? Well, number one, the microbe has got to find a portal of entry. Okay? Number two, they've got to be able to attach. Number three, they've got to be able to survive the host's defenses. And number four, they're going to cause damage and disease. And we're going to go into a lot more detail about each of those, and that's why I just was hitting the high spots. Okay? And then last but not least, if a microbe enters, one must also be able to exit. Yes. Alright, so what are some factors that weaken a host's defense and increase susceptibility of infection? Well, extreme ages, that meaning the very young and the very old, especially if there's prematurity involved. Any kind of genetic defect in immunity and acquired defects in immunity. Surgery, transplants, organic diseases such as liver malfunction, diabetes, cancer. If the patient is taking chemotherapy or some immunosuppressant drugs, stress, both physical and mental stress can weaken your host immune system. And of course other infections are going to cause a problem for us as well. So, what is a pathogen? Well, we know that a pathogen is something capable of causing disease. So a true pathogen is capable of causing disease in a healthy person with otherwise normal immune defenses. So a true pathogen would be something like the flu virus, the influenza virus, the plague, malaria, the protozoan that causes malaria. But then, on top of true pathogens, you have what are called opportunistic pathogens. And these are diseases that grow when the defenses are compromised, and then because they're compromised, then other organisms seize the opportunity to kind of grow uncontrollably and then to capitalize on that weakened immune system. So for example, yeast, Candida albicans, is notorious for being an opportunistic pathogen when, for example, you've been on antibiotics and it kills off some bacteria, then the yeast, basically flourish as a result of the others being taken out of that environment. So, severity of disease depends on virulence. And what is a virulence factor? It's basically any characteristic or structure that allows us that microbe to be more capable of becoming pathogenic. All right, so let's start off with how microbes become established. Okay, number one, portals of entry. Now, to me, this kind of makes sense. Basically, think of anywhere on your body where the outside could come in contact with the inside. So we can talk about something being exogenous or endogenous. Exogenous, ex meaning from an outside source, outside the body. Endogenous, something that already exists inside the body. So if we look at this picture, clearly portals of entry could be things like the eye, the conjunctiva, respiratory tract, clearly you have to breathe, gastrointestinal tract, obviously you've got to eat, your ear canals, your skin, your urogenital tract, and your, urogenital, both urinary and genital areas would be a source of port of entry. So, how do they get in? Well, things like from the skin, from nicks and abrasions, punctures, and incisions. Okay, gastrointestinal, well, clearly anything that you ingest, food or drink. Respiratory, breathing. Okay, oral or nasal cavities. Urogenital tract would be sexual and displaced organs. And then transplacental would be from mother to offspring, or mother to unborn child, and we would call that a vertical transmission. All right, portals of entry. I always like to look at this chart because it kind of gives us an estimated number of sexually transmitted infectious diseases in the U.S. And this data is from 2015. It comes from the Center for Disease Control. And remember that these numbers are going to be a little bit off because these are the only STDs that are officially reported to the CDC. That's where we get these numbers. So things like HPV, human papillomavirus, well, there's 14 million new cases per year. So what I like to look at is, again, I don't expect you to know numbers, but what I like you to look at is, well, why is HPV on the rise? Why are we seeing such a large number of new reported cases of this? And I think the reason we're seeing more cases of this is that people don't really realize that genital warts is a sexually transmitted disease. It does not carry the same stigma as something like, for example, herpes or gonorrhea or syphilis or chlamydia. And so because of that, I think that it's on the rise because, again, typically if you have one of the other conditions, it's usually more telltale, meaning you can see it. For example, if a female has HPV, you're not going to know you have it unless you go to your gynecologist and have a pap smear and he identifies it, because it would be in the upper vagina or the top of the cervix region. One of the things I find interesting is new HIV infections are actually 35,000. Again, maybe because back in the 80s, people just didn't really know to practice safe sex, especially in those risky behaviored populations, IV drug users, things like this. So when we're looking at these numbers, again, I don't want you to know the numbers. I always like to ask myself, why? Why are these numbers higher? Why are these numbers lower? And a lot of times I really think it's perception. I think it's perception. All right, pathogens that can infect during pregnancy. If you remember the mnemonic device STORCH. So syphilis, toxoplasmosis, other diseases like hepatitis B, AIDS, chlamydia, rubella, cytomegalovirus, and herpes. So that's kind of the word that you can remember to help you remember that these are the ones that can actually cross the placenta. All right, ID, infectious dose. So the ID is the minimum number of microbes required for an infection to proceed. So microbes with a small ID have greater virulence. Lack of ID will not result in infection. So, Ms. Bradley, can you put that into a term that I really can understand more? In other words, if it only takes a few cells, if it has a low infectious dose, then if they'll say, and if a little dab will do you, if a little dab will make you sick, then that means that's a fairly virulent bug or microbe, and that should kind of alert you that it's easily contractable. So, for example, right now we're having measles outbreaks, and we didn't have these 20 years ago, 10 years ago, like we're seeing now. And if you look at the ID, the infectious dose, one measles virus can cause you to have measles. And remember, viruses are very, very tiny and easily transmissible, and then the route of infection is obviously respiratory. Okay, shigellosis. This is going to be a diarrheal disease. 1 to 10 cells can make you sick. So if you think about eating contaminated food. The norovirus, that one's notorious for being on cruise ships. Again, 18 viruses or less, so very, very low number. Tuberculosis, smallpox, encephalitis, the plague, gonorrhea. See, we're getting up to 1,000 cells. Cholera, 100, now what is that, hundreds, thousand, millions, 100 million cells. So again, ID, the lower the ID, the more virulent, the hardier, the, for lack of a better way of saying it, the stronger the microorganism. Okay, step 2, attachment. Well, does the microbe have something that helps it adhere or adhere to the host? And so you've got to think about things like, does it have fimbriae? Remember those little hair-like structures that help it stick? Does it have a flagella? Does it have an ability to swim? Does it possess that glycocalyx on the outside as a protection anti-phagocytosis mechanism? Does it have cilias? Does it have hooks, suckers, barbs? Does it have something that helps it to stick or attach to the host? And again, here's a table just to kind of give you some ideas of things that these microbes have that they possess that helps them to adhere. So again, if you look at that list of diseases, it makes a little more sense as to why they're so transmissible, or why humans have such a problem with them. Okay, well, once you have then adhered, the step 3 is that you're going to actually invade. And when we think about invading, very often microbes will give off exoenzymes. X, give off extracellular enzymes that dissolve barriers that may be in place to help protect tissues and cells. Okay, so does the microbe give off an exoenzyme, a toxin, to help it break through the defense barriers? Speaking of toxins, there's another one. Toxins. So again, not only do some of them give off enzymes that help, but some of them actually give off toxins. Okay, some of them have the ability to block phagocytosis. So basically, they figured out a way to not be eaten by our natural defense cells. Okay, some have developed these things called invasion factors. And it says right here, Salmonella is a unique system to invade intestinal cells. After adhering to the microvilli with a fimbriae, it injects a protein, and this protein disrupts the actin filaments, causing the cell to basically not be, a series of ruffles that surrounds the bacterium and pulls it inside. So some of them have actually figured out a way to get the cells to bring them inside. Right? So again, very, very creative, if we want to say. Okay? All right, so I mentioned toxins. So specifically, there's 3 vocabulary words you need to know here: toxinosis, toxemia, and intoxication. So toxins, period, are some chemical that is made by the microbe that often has a poisonous effect. So toxinosis is going to be an adverse effect of toxin. Anytime you hear the word toxemia, that means that the toxin is being spread through the blood. And intoxication is caused by the ingestion of the toxin. So what I tell people is that sometimes the bug makes you sick, but sometimes what the bug gives off makes you sick. And that would be the case of like intoxication. So for example, botulism, the microbe that's responsible for botulism, it's not the bug that makes you sick, but what the bug gives off, the toxin that the bug gives off that causes the problems. Okay, endotoxin versus exotoxin. When Ms. Bradley hears endotoxin, I think gram-negative cells. Say one more time. Endotoxin, gram-negative. So it says endotoxins are not secreted but released after the host cell is damaged. So gram-negatives. Gram-negatives tend to give off endotoxins. When I hear the word exotoxin, I tend to think gram-positive. Okay? These are secreted by a living bacterial cell into the infected tissue. Okay, and they disrupt the membrane. So again, exotoxin, Ms. Bradley thinks gram-positive. When I hear the word endotoxin, I think gram-negative. So what are the effects? Well, it depends. If you give off an exotoxin, the body is probably going to respond very quickly. Okay, think about it. It's given outside the cell. It probably is going to get into the bloodstream faster. You're probably going to see signs and symptoms of that much quicker than with an endotoxin, because an endotoxin is going to have to get into your cells, and it's going to take a little longer for those toxins, to build up to where your body would actually respond to them. Notice it says target organs are damaged. Okay, when you get exotoxin and endotoxin. Typically, endotoxins, you're going to see signs and symptoms. You're going to see physiological effects: fever, malaise, ache, shocks, lower blood pressure, higher like pulse rates. You're going to see some manifestation of these toxins. So, love this. When I say I love this chart, because when I look at it, I see things like this. Okay, exotoxin. What did Miss Bradley tell you when she hears exo? Exo means to give off. I think gram what? Positive. So gram positive. Well, what does that mean? Well, typically the person is not going to have a fever. Okay, they're not going to have a fever, and it's going to come on acutely. It's going to come on fairly quickly. So when I think of exotoxins, I think gram-positive. I think that the patient's probably not going to have a fever, and that it's probably going to come on fairly quickly. With endotoxins, it takes a much greater amount of the toxin. What we're going to see is less specific signs and symptoms, and they're going to be systemic all over the body, opposed to being very localized in one area. So you're going to see things like fever, inflammation, soreness, weakness, shock. Okay? Often they're going to have a fever, like I just said, that fever. And typically they're not going to, this is going to be, I hate to say more chronic, but it's not going to have as an acute onset. It's going to take a little bit longer for this to manifest itself. So again, love this chart in that it helps me to kind of visualize exotoxin versus endotoxin, which one runs a fever, which one doesn't, which one comes on quickly, which one's going to have an all-over body effect versus a very localized effect. And the example it gave is like AB toxins in Corynebacterium diphtheriae, and I don't think this was an objective, so I'm just going to kind of click over this fairly quickly. So let's look at our concept question. Only gram-positive bacteria can secrete exotoxins. Okay, now be careful, because I did tell you that exotoxin, Miss Bradley thinks gram-positive, right? But go back, before we answer that, go back, read it right here. Exotoxin, a few gram-positives, but there are also what? Some gram what? Negatives. So now go back and read the question. Only gram-positive bacteria can secrete exotoxins. And hopefully you said false. Yes, when I think exotoxin, I do think gram-positive, but there are some gram-negatives that can also give off exotoxins. All right, I'm going to stop here, and then I'm going to pick up with the next video.